6:25 on your clock, and a new study suggests a first-of-its-kind blood test that's a game changer when it comes to screening for colon cancer. Fox 43's Amy Lutz lets us know what a local specialist has to say about it in this week's Health Smart.
Colorectal cancer is the second leading cause of cancer deaths in the U.S.
We know that there are certainly environmental factors that play a role. Things like tobacco use, certain types of diets that patients follow, but we're also learning more and more about different genetic variables that influence the prevalence of colon cancer that we're seeing.
What we don't know is why more than 75% of those who die from the illness were not up to date with recommended screenings, such as a colonoscopy.
Yeah, so we know with colon cancer that early detection can prevent up to 90% of colon cancer-related deaths. And that's a startling number.
Dr. Frank Senatore with WellSpan Health says much of it is due to the stigma surrounding colonoscopies. That's why he says a new blood test could help change that number. A new study published in the New England Journal of Medicine shows the Shield blood test can accurately detect 5 out of 6 cases of colorectal cancer.
It isn't widely adopted at this point, but this blood test essentially can detect DNA related to colon cancer in the blood.
Dr. Senatore says it's important to know the blood test is not meant to be used interchangeably with colonoscopies because it doesn't detect polyps as well.
Colonoscopies range somewhere between 75 to 93% effective at detecting these precancerous polyps. In the study out of the New England Journal of Medicine looking at this new blood test, it was only 13% effective at finding polyps.
Still, he says something is better than nothing.
We always say the best screening test is the test that you actually get performed. An ounce of prevention is worth a pound of cure. So get a screening test and talk with your provider if you have any questions.
Experts say by the year 2030, colorectal cancer could be the deadliest cancer in people ages 20 through 49. Still, Dr. Senatore says people of all ages should tell their doctor if they have any suspicious GI symptoms. With your Health Smart Report, Amy Lutz, Fox 43 News.